We were concerned about two things related to depression in medical students. The first is that we know the prevalence is somewhat high, a bit higher than the general population perhaps. But the second concern was that medical students do not seek mental health care like you might suppose they would. Theoretically, they have better access to mental health care than other people might, but actually they don't make use of that. So the two together caused us to wonder about stigma, what kinds of barriers there might be to keeping students from seeking appropriate mental health care. And that's what took us to the next level of study, which is to really understand the details of stigma, how students experience that stigma, specific types of situations that might be particular barriers to them seeking mental health care. I'm not sure we're surprised that there is a high level of stigma. I think we all suspected that. I think we're a little surprised that there were some fairly harsh statements made and some fairly negative statements made about students who were depressed, and statements about how they were not as valued as members of the medical care team, and statements about how medical students with depression might not be as good at carrying out their responsibilities or might not be as good at taking care of patients. And not all students believe that, and it's certainly not universal amongst medical students that they feel negatively about depressed students in that way. But the fact that depressed students even feel some of that is very worrisome. And I think what it speaks to is the very intense, very demanding nature of medical education and medical school. Students feel under tremendous scrutiny and feel like there's tremendous pressure to be perfect, and that they cannot make a single mistake, and they have to be perfect in all regards, and they have to function at the highest level at all times. Now, to some extent, we want that. We want doctors to be that good, but we also want them to be aware of their own health and their own wellness and be willing to do something about that if there's a problem, and to feel like it's acceptable, and not even acceptable, but actually the right thing to do professionally, to seek help and to be treated and to get better. Two reasons that these are important. The first is that we want doctors to function at the highest level, so we want them to be treated. We want there to be an atmosphere in medical school that encourages appropriate treatment, that actually makes mental health an important feature of medical education, and that there's an environment that really encourages that. As far as patients are concerned, I think that we would worry a bit that if medical students are critical of other students who are depressed, then we wonder how they feel about patients who are depressed. And is there some carryover that says that patients are somehow not worthy of care if they're depressed, or somehow not deserving of some help? We don't actually have any data to suggest that, and we know that the medical profession in general is getting much more oriented to the care of depression. Primary care physicians are getting much better trained, much more attuned to the needs of patients who are depressed. We know that stigma in patients is actually going down, so that's all positive, but this is a little worrisome that there still is a residual negative feeling on the part of medical students about this.